As we mark Breast Cancer Awareness Month, today we're highlighting a local organization working to empower patients and eliminate health inequities. Equal Hope provides free breast and reproductive cancer services and resources to uninsured or underinsured people. Joining us now, Dr. Paris Thomas, the CEO of Equal Hope. Welcome in. Thank you for being here. Nice to see you again. Also, Tracy Kincaid, a breast cancer survivor and also a client of Equal Hope. Thank you both for being here.
Thanks for having me.
It's good to have you. This month is always a good time to raise awareness about so many of the inequities that are so clear right now. Equal Hope was founded to address some of those disparities in breast cancer mortality rates. Can you talk about some of those disparities and also how the access to care plays a part in that?
Yeah, so when we talk about disparities, the reason that our organization was founded, because when you look at data about over 40 to 50 years ago, there was almost no disparity between white and black women's breast cancer. In 2008, that disparity was at 62% here in Chicago, which was greater than any other city in the nation. So we were formed under the original name, the Metropolitan Chicago Breast Cancer Task Force, and we formed a consortium and task force of individuals who did this work. And there were three problems that were identified: access to mammography, access to quality mammography, and then access to quality treatment. And from there, our organization has been really wedded to ensure that individuals across the Chicagoland area have access to care, but high quality care. Where you go, because we know if you're able to get a screening, a timely screening, it can save your life. The earlier detection, the better survival. But then also in doing that work, we found that over the years we were able to reduce that death rate. In 2018, it dropped to 32%, which was truly significant for any other city, and Chicago became #1 in reducing disparities. But also today, that disparity is still upticking upwards. So we see there's more things that are happening specifically in the space of breast cancer disparities. So when you look at Asian Americans right now, they're having a higher incidence of breast cancer because of lack of screening. When you look at women under the age of 50, this generation has more diagnosis in breast cancer than any other generation. When you look at treatment, we know that Latin women are more likely to have a delay in treatment, and as well as black women are still being treated with more forms, aggressive forms of breast cancer, such as triple negative breast cancer.
And I know you and I have done stories together in the past where we really dug into these disparities and that lack of quality access to care. Tracy, you got connected with Equal Hope. How did they help you in your breast cancer journey?
Equal Hope has been a tremendous help for me getting back and forth to my doctor's appointments, making sure that I did not ever miss getting a mammogram screening because of the lack of insurance or being underinsured, and for that I'm really grateful. And also just providing breast cancer survivors with programs that to help us, to cope.
Yeah, the support.
And just having that support to cope with the disease itself.
And Dr. Thomas, as I've done stories with you before, I've spoken to some of your clients who said, I wouldn't have been able to get quality screenings. I wouldn't have been able to get to those screenings if it wasn't for you guys. How do you actually, in practice, help clients like Tracy?
Yeah, so our motto is one that's evidence-based, and so the way that we're able to really tackle this disparity work is for us to understand where disparities lie. So we use our data and we have our research arm where we understand that there are certain communities such as Auburn, Gresham, Washington Heights, West Garfield Park, Austin that have some of the higher disparities, and it allows us to deploy our outreach team. We have community health workers that come from our actual communities.
Amazing.
And they're going into regular settings. They're not just doing health fairs, they're going into everyday settings that you can find people, whether it's your grocery store, your banks, and really asking them the questions: have you had a mammogram? Do you have access to care? Are you insured? And if they're not, signing them up and providing them a patient navigator. And patient navigation has been known throughout research and has been proven to be one of the successors of helping people get through treatment and have survival. And so we have patient navigators that are really addressing all of these things. So when you think about care, and I tell people, I myself do not enjoy scheduling appointments. I just don't have time, right?
Yeah, it's
but
hard.
to have someone take that barrier off of you and understand your schedule and do that work for you, but then also address the drivers of health, such as do you have transportation? Do you have housing? Do you have child care? Our navigators are really providing a holistic service to ensure that people can truly survive from treatment and focus on the treatment solely.
And I've spoken to some of your patient navigators in the past, and just them walking with these breast cancer patients through their journey is so big. And Tracy, I see you saying, yes,
Yes.
it is. How did that help you, and how have you seen it help some people that you know as well?
Oh my God. It left me to not ever have to have an excuse for not getting to that doctor's appointment the for not having that appointment scheduled because I had someone to hold my hand. The stress, it's a lot of work. It's really a job to manage a crisis such as a breast cancer diagnosis, and just to have someone there to hold your hand, to make those appointments with you, not only just to make those appointments with and for you, but also to go with you on the appointment if necessary. That's a tremendous amount of stress reliever.
It helps. It helps relieve that stress. And Dr. Thomas, I know one of the things I also learned about patient navigators, which I know is a big part of that process, is how they help you sort through so much of the information that you're getting at these appointments that you may not understand or be able to comprehend, like what's happening to me, because you're in shock sometimes.
Yeah, absolutely. So I think it's kind of when you're being diagnosed with a cancer and you're getting those treatment options, right? I hear you, but I'm still processing that I was even diagnosed with a cancer. So to be able to have our patient navigators who have the oncology background and some of our nurse navigators who step in at this realm to say, hey, did you hear what the doctor said? These were your options, but then also be able to repeat those options to your family. It's almost having that health care come to your home and having that there, but it's also our ability to be agnostic. So we're not wedded to one facility, and we're able to understand a lot of the issues and barriers that people face, specifically when it comes to treatment and insurance. We've had several individuals that end up on charity care, and a lot of our charity care programs today are falling through. And so it's our ability to move people and have someone that stays with you that whole time versus one facility handing it off to another, but having someone that already knows your story and be able to relay that to the next entity.
Absolutely. And Tracy, what's your message to people watching who may be in a space where they need help, they need support, and they don't really know where to turn?
Yes, I would say, first of all, I encourage all of you out there to reach out, not to be afraid, to contact Equal Hope. I just tell them to go to equalhope.org, and all the information is available to you. There's a registration form. I have personal numbers that I can give them if they need it, to reach out to the patient navigators. And just don't be afraid, because fear is not our friend.
Yeah, I love that. Thank you both so much for joining us. Tracy, thank you for sharing your story and how Equal Hopes help you. Dr. Thomas, thank you for being here. I'm glad we can keep the conversation going. It's so important. And for anyone watching, to learn more about Equal Hope and their services, head to equalhope.org. Equal Hope is also hosting a fundraiser this month called the Pink Plate Tour. You're seeing it on your screen here. Participating restaurants will donate a portion of proceeds to the organization, so you can visit their website to also learn more about that.